what I have to speak about today is what is the epidemiology and current trends of pediatric malaria. And that's a disclosure slide I have that I do not have any financial relationship and marketing or reselling any product, and we are not actually like portraying any of these products from any of the pharmaceutical. So today is the World Malaria Day, which is 25th of April. And of course, the further disclosure is that few images are from the internet source. And this is really important to know that uh, when there are a lot of malaria and there are a lot of mosquitoes, so they're also taking out time to play and to know that, okay, what's going on with the human beings, and human beings are also in trouble because they're just sucking our blood and they're breathing them well. And I just mentioned about this slide that the Genesis Pharma support that program. So what I'm going to talk about is malaria existence, which one and most prevalent, what is sensitive and resistant part, drug to use, some concerns, and few discussions on the basis of that. So when the malaria happened, right, this is transmitted by the mosquitoes. And of course, they always talk about, okay, son, how was your flights of yesterday? And the son says, I feel really good because everybody actually clapped for me. And it's not clapping, actually, it's just a reminder that, okay, we are just in a bad shape because they are just sucking and taking out our hemoglobin. Uh, so when we talk about all deaths in children age 1 month to 5 years, and in terms of which come first, and there's diarrhea, pneumonia, measles is all common, but there is another common theme that's called measles. So we and malaria, we always forget that globally, diarrhea pneumonia is one for the developing countries and developed country, but also there's measles epidemic going on, and also malaria is one of the most common leading factor for that. And that's not third; it's actually the fourth. But this is what it is supposed to be, and it's a reality of the time. And you can see this geographic map of the globe, and you can see that the progress of the global technical strategy group, that how's the malaria global incidence has to decrease, and the countries has to work, and then the regions has to work to reduce this malaria transmission. The more urbanization is happening, the more deforesting happening, the more we have more vertical buildings, the more malaria has to, or the mosquito has to breed in our areas. So you can see this Pakistan um, part here. And this is actually a little bit of reduction in terms of what we're supposed to be, but we are not just catching, we're just catching up what we're supposed to be. But when we see these patients, so what is the risk of geographical distribution, their lethality, and drug resistance over the period of time? So you can see there are the five species of the malaria. And on the other hand, you can see their range, or range means their access to the human being across the globe. So you can see the pan tropical, temperate, tropical, and they're all there, right? But this Vivax and falciparum are the most common in our part of the world. But you can see this, they have highly prevalent, and they are lethal in terms of risk. When talk about lethal in terms of, we talk about mortality. We don't talk about morbidity. We talk about mortality leading to the ICU stay, leading to severe complication. And then their tendency to develop certain drug resistance. And you can see both of them, Vivax and Filaria, have this tendency to develop good drug resistance. The good part is that falciparum do not relapse, right? That's a good for human being, right? But the Vivax does relapse. So we will need to know if the Vivax does relapse. We also need to manage this Vivax in terms of knowing that it's going to relapse, and tell our patient that, okay, these are the certain tests you have to do before we're going to go for any of the relapse medicines. On the other hand, you can see this is Pakistani map, and this is malaria control program leading, and that this map actually tells you from Gilgit Baltistan to Karachi, and you can see the endemicity, or the use of anti-malarials in these areas. and also the number of cases being reported in these areas. So you can see this, the Sindh belt and the Balochistan belt has more malaria cases compared to the other part of that. And again, the Eastern Mediterranean region has already showed their concerns about contribution of Pakistan as a malaria number of malaria cases across this thing. So when they say that there's a high number of cases from Pakistan, so they also mentioned that Pakistan come into the category of a moderate malaria endemic country. So it means that that the malaria endemicity can go further if there are more deforesting happen to an endemic malaria country, because that's not far away. So that's the question. So the question is that among 100 suspected malaria infections in Pakistan, according to Malaria Control Program, what is the potential contribution, right? So is the Vivax highest, followed by, thank you, is the Vivax highest, followed by falciparum, or the Vivax followed by falciparum, these numbers. So of course, any best guess? What is the best guess here? A, B, C, D. One thing is for sure that Vivex is high because it's everywhere, right? Right? That's the best clue. But what is the best number in terms of percentage? Out of 100 cases you see in your clinical setting, how many of them will be Vivax? This is national data. Okay. A, B, C. How many people feel this is A? Please raise your hands. All right. How many people feel this is B? Please raise your hand. How many people feel this is C or D? Perfect. So the answer is coming in the next coming slide. So you should be happy if your answer is correct. All right. So okay, let's move on. So look at this. So malaria prevalence in Pakistan, and there's a systemic review. And there was meta-analysis for 2006 and 2021. And you can see this is like malaria reported across Pakistan. Of course, they always are reporting bias because few people report more, few people report less. But you can see that there are a lot of areas in Pakistan where this malaria testing happen, and these are the clinical setting. Um, and this is the malaria prevalence in Pakistan, the same thing. And then you can see this number of publications per year according to the prevalence. And this prevalence shows that, okay, sometimes it's just 100% to again 10%, right? But what is the real scenario? It's coming, don't worry. So whenever we just think of malaria and we test it of malaria, right? That's what we always do, right? And the best test we do MP or we do MP-ICD. The doing for MP helps us in doing the thick and thick smear, all right? And for the NP-ICD, we just identify the species level, but we don't understand the drug resistance at this time, right? So look at this. So anytime you think of malaria and you test for malaria, out of 100 people, 23.3% that come out to be positive. So even if you think that this is malaria and you test for malaria, out of 100 people, only 23 will come out to be malaria MP or MP-ICD positive. It means that if you start the anti-malarial medicine thinking of this patient has malaria, 77 times you're wrong, giving this medicine inappropriately. All right. So it's always better to test if you have a better lab and the result come out in 4 hours, sometimes 2 hours and 3 hours. So better to test instead of treat. And that is what the guidance is all about, right? There are situations when this is difficult, of course, that's fine. But in most of the situation, either you go to Nawab Shah, either you go to Sakhar, there are labs who do the MPICT. And even the MPICT can be done in your clinical, clinic, right? Any of the dispenser can do, just require one drop of blood. So remember, testing is essential. So if you do not test, you may treat wrong your patient. All right. Okay. All right. So this is the answer. Out of 100 time in Pakistan, you test for malaria, and out of 100 time, the MP come out to be positive. There is 79.2% chance that they're going to be Vivax. All right. So there is 79% chance they're going to be Vivax, right? So what is the chance they're going to be falciparum? They're going to be 16% chance, 16.6% chance they're going to be falciparum malaria, right? And this is the slide, right? And you can see this all national data from the systemic review from Pakistan, right? Either you do testing in Afghanistan, Pakistan part, which is southern part of near to Afghanistan, or the Balochistan or Sindh. This is the trend, and you have to see this trend is continue. And just 4% they're going to be mixed malaria, right? So in terms of testing, please do test. This is a message. The second thing is like when you do a test, think of which drug you're going to use, because out of 100 times, 79 times there's going to be falciparum malaria. All right. There's going to be Vivax malaria. And this is a molecular marker surveillance. And when you talk about molecular marker surveillance data, the slide is coming, right? So we also need to say how many develop the tendency to develop certain kind of resistance for certain drugs, right? And we also always check for these things. And the testing was done for those patients who come out to be malaria, and their genetic testing was done for those who coming out to be MP positive, right? And among those, there are only few markers or the resistant markers that come out to be positive. So among those, and you can see the resistance pattern for the falciparum for the chloroquine is 75% compared to the Vivax. So it seems like that Vivax is more sensitive and do not develop certain type of drug resistance in Pakistan compared to the falciparum. And this is also a surveillance of these markers, and you can clearly say that chloroquine and falcidar or has to be a high resistance against falciparum and low in Vivax. And this is data published in not far away, 2021. And chloroquine could still be used for PVIVAX infection, but it has to be tested in vitro, particularly where there is a replacement therapy or there is a need for justification. So, in summary, it's a potentially serious threat. Number one. Number two, thinking of malaria, you need to test for malaria. We have a resistance pattern, but resistance pattern is mainly for the falciparum and not for the Vivax, and hence the chloroquine is a better drug to start with the Vivax. Malaria is a potential time bomb, particularly when there is a sick patient in your community or sick patient in your ICU. And anytime you have a sick patient ICU, listen to the PEDS ID folks, which is around, because that's extremely important. Um, and thank you. Please note down your questions, so we'll take the questions at the end of those presentations. Thank you.